My name is Don Mahler. My academic title is Emeritus Professor of Medicine at the Geisel School of Medicine at Dartmouth. I presently work at Valley Regional Hospital, where I am Director of Respiratory Services. This presentation is entitled Shortness of Breath and is sponsored by the Patient Education Work Group of the Chest Foundation. This slide shows a typical individual who seeks medical attention for the main complaint of, why am I short of breath? It is important to establish the correct diagnosis because appropriate therapy depends on the cause. This slide reviews normal breathing. There is a medulla, which is part of the brain stem just below the brain itself, which is a pacemaker for breathing and provides, as shown by that downward black arrow, automatic command to breathe. In addition, the brain itself, the cerebral cortex, has the ability to have voluntary control, which means breathe slower, breathe faster, blow up a balloon, or other maneuvers. The respiratory system contains numerous receptors, also called sensors, which provide feedback information to the brain as represented by that upward black arrow. The next series of slides considers the different receptors in our body. The carotid body is located in the neck at the bifurcation or division of the carotid artery into internal and external branches. This blue circle highlights the presence or position of the carotid body, which detects oxygen level in the blood. This slide shows the position of the carotid body in the neck. If the blood oxygen level is low, the carotid body sends message through nerves to the brain. In addition, there are receptors in the airways of the lung, which detect narrowing and irritation. Activation of these receptors send messages to the brain. With airway narrowing, there may be difficulty emptying the lungs of air, leading to trapping of air called hyperinflation. This word means too much air in the lungs. It depresses the diaphragm muscle, and muscle then is activated receptors, sending messages to the central nervous system. Another problem can occur when fluid, such as with heart failure, infection, as occurs with pneumonia, inflammation and/or scarring in the lung tissue, activate receptors, again, messaging the brain that something is wrong. Receptors are also located in the pulmonary blood vessels called the pulmonary artery. This slide shows a blood clot or pulmonary embolism, which can be identified in this magnified view. Activation of receptors in the pulmonary vessels send messaging to the brain. So there are 5 major receptor mechanisms: the carotid body located in the neck, receptors in the airways, blood vessels, lung tissue, and respiratory muscles can all contribute to messaging to the brain as represented by these red arrows. The brain integrates this information, processes it, and then sends a message down to the respiratory muscles that controls the depth and rate of breathing. This messaging from the brain is called the demand to breathe. The response of the respiratory muscles is called the ability to breathe. If there is an imbalance between the demand and the ability to breathe, this causes or contributes to the feeling of shortness of breath. When individuals with many types of different conditions are asked what it feels like, they often choose words such as the work and effort of breathing, which reflect the work and effort performed by the respiratory muscles. In addition, psychological disorders such as anxiety, panic, and depression can cause people to feel short of breath by increasing the demand to breathe, and can also magnify the experience of breathing difficulty if someone has a pre-existing condition. Shortness of breath can be considered acute if it has a sudden onset, or chronic if it develops gradually and lasts more than 1 month. There are 5 major or common causes of shortness of breath, which I will review in the next series of slides. These conditions include anemia, cardiovascular disease, deconditioning, psychological disorders, and respiratory disease. Anemia is defined as a low number of red blood cells. Red blood cells are important because they carry or transport oxygen to all parts of the body. This red arrow depicts 1 red blood cell on a microscopic view of blood. With low number of red blood cells, less oxygen is delivered to the tissues, including muscles. The tissues and muscles send signals back to the brain to increase breathing and to increase heart rate. This increased breathing response is perceived as shortness of breath. Cardiovascular disease is a common problem and a common cause of breathing difficulty. The heart demonstrates on the left blood vessels, and on the right magnified blood vessel, where fatty deposits narrow the coronary artery. This reduces blood flow and reduces delivery of oxygen to the heart muscle. Another type of cardiovascular disease is valvular heart disease. The valves in the heart control the flow of blood between different chambers. This blue oval highlights the aortic valve, which controls the flow of blood out of the left ventricle through the valve into the aorta. If the valve is tight, it is called stenosis, and it limits blood flow, and backup of fluid can occur. If the valve is leaky, it is called regurgitant, and blood flows back to the left ventricle rather than proceeding through the aorta. The third major cardiovascular disease affects the myocardium, or the muscle, as highlighted by this red arrow. A viral infection is a common cause of myocardial disease called myocarditis. Any one of these 3 cardiovascular diseases can lead to the development of edema or fluid within the lungs. The X-ray shows white fluffy areas in the right and left lung, which represent edema fluid. The edema fluid activates receptors, sending messages to the brain. It is very common in pulmonary edema that low oxygen level develops, leading to activation of the carotid body, which sends messages to the brain. A third common condition is called deconditioning, in which there is loss of physical fitness due to reduced activity. This may occur as a result of an injury, where someone is not able to ambulate, or can occur following surgery, such as hip or knee replacement. With deconditioning, the muscles are less efficient, send messages to the brain to increase breathing and increased heart rate response. This increased breathing contributes to shortness of breath. Psychological disorders are another cause of breathlessness. Anxiety and depression are the 2 key ones, and as mentioned earlier, can cause shortness of breath and can magnify shortness of breath that already exists. When individuals with anxiety are asked to describe their experience of shortness of breath, 2 words are commonly selected: my breathing is frightening, and my breathing feels awful. The respiratory system is a common area for disease to occur that contributes to shortness of breath. In both asthma and COPD, there is narrowing of the airway. This contributes to messaging to the brain. As mentioned previously, narrowing of the airway can affect the ability to empty the lungs of air, leading to hyperinflation. This activates receptors in the breathing muscles, particularly the diaphragm, which send messages to the brain. In some, but not all patients with asthma and COPD, a low oxygen level can develop as a third mechanism contributing to shortness of breath in those with asthma and COPD. When those with asthma are asked to describe their experience of shortness of breath, some, but not all, describe chest tightness due to constriction of the muscle that wraps around the airway. In interstitial lung disease, inflammation and scarring of the lung activate receptors, sending messages to the brain. In many circumstances, there is a low oxygen level associated with interstitial lung disease, which activates the carotid body, and a second process contributing to shortness of breath. When individuals with interstitial lung disease are asked to describe their experience, they typically choose the phrase, "My breathing is shallow," which reflects the restriction of the lungs due to inflammation and or scarring. Pulmonary embolism was shown before, activation of receptors in pulmonary vasculature or pulmonary blood flow. It is common to have a low oxygen level when an individual has pulmonary embolism, which activates carotid body, sending messaging to the brain. Pulmonary hypertension is demonstrated at the bottom right, where the blood flow is slowed due to pulmonary hypertension. This can activate receptors, sending messages to the brain. In many individuals who have pulmonary hypertension, there is a low oxygen level, again, activating the carotid body to messaging the brain. So in summary, shortness of breath is due to an imbalance between the demand to breathe and the ability to breathe. A low oxygen level is only one reason for shortness of breath. Understanding the cause of shortness of breath is important for optimal treatment. Hopefully this information helps you understand why you or a loved one may experience shortness of breath.